Pneumonia is a common lung infection caused by bacteria, a virus, or a fungus. As the lungs become inflamed and fill up with fluid, breathing becomes more difficult, and that can make it hard for the oxygen you need to get into your bloodstream. Many factors affect how serious a case of pneumonia is, such as the type of germ causing the lung infection, the person's age, and their overall health. Ed Neuzil, board-certified advanced practice registered nurse at the Allergy Sinus and Asthma Family Health Center, explains what pneumonia is and some of the early steps we can take to try to protect ourselves from it.
Pneumonia is like a bronchitis that went crazy. In bronchitis, you have an inflammation of the airways, and you can have a thick mucus that you expectorate, but it doesn't completely close the bronchial part of it. As this becomes thicker, and it becomes more congealed, it can actually completely close that part of the bronchial. And if you were to have mucus that completely blocks those bronchioles, no breathing occurs. So you can end up with a, so to speak, walking pneumonia that's minimal, or you can end up with a pneumonia that encompasses most of the airways, and that's where people end up in the hospital and unfortunately sometimes pass away because there's no way to get oxygen into the person. Those individuals that have a tendency towards pneumonia, or actually anybody, we need to look at our vaccinations. The flu shot is something, or the influenza vaccine is something that people really need to look at, and as suggested, something they need to receive, if not contraindicated, every year. We found that the pneumonia shot that was once considered a once-in-a-lifetime injection is now recommended to be reboostered after the age of 65. And there are two different pneumonia shots. There's the regular Pneumovax, and now there's the Prevnar 13. So even though you were boosted at one time with the Pneumovax, it's now recommended that the Prevnar 13 also be administered. And as we're living longer and longer, we're looking at even more of the childhood vaccines to be re-administered. And that's going to be coming through more studies in the future. But we're finding that we're starting to outlive our immune systems, and we're going to notice that more things, are going to occur.
To get in touch with Ed Neuzil and the staff at the Allergy Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Booster Protection Story Link icon on our homepage, yourhometownhealth.com.